Hey, I was just going through some of the latest COVID info, considering we are now in November. So we are 7 months into our pandemic after being in lockdown here in South Africa from the end of March. And the information we have available to us is the same information we had available to us 5, 6 months ago. So going forwards, making decisions, planning next year, 2021 is around the corner. Business, school, industry needs to plan ahead. What do we plan for? What information do we have? Well, it dependent on policies that the government puts out. Now, from a school point of view, because my daughter's in a preschool and this is of interest to me, I'd like to go through what the official policy and procedure and protocol is as issued by the relevant departments for the schools. And bear in mind that this was issued previously. This particular document here is by the Department of Social Development and was issued in June and is the standard operating procedures and guidelines. They have all the information you need when it comes to masks, which is quite a hot topic, especially in the hot Durban humidity. The official requirements from the states are 8.5 face masks and rubber gloves. The wearing of face masks is only effective when used correctly. Alright, this is an important factor in the actual prevention of disease transmission. The young children, 5 years and younger, in general will find it difficult to cope with this practice. This means there is a real risk. However, the South African Pediatric Association recommends an individual child older than 4 years be required to wear a face cloth mask to prevent disease transmission. The use of plastic shields and other safety categories is unnecessary, but it's not discouraged. Furthermore, the wearing of masks by children younger than 2 years is strongly discouraged, so that would be babies and infants, due to the risk of suffocation, whereas the wearing of masks for children 2 to 5 years is not recommended, due to the poor ability to comply with the requirements of correct and safe wearing of a mask. What? 2 to 5? Not recommended. No child aged 2 to 5 is required to wear a face mask or other form of shielding unless under circumstances as described below in paragraph C. So that was the official policy that went out. There were other document releases. Here's the Government Gazette dated 10th July. Alright, they had some things to say about masks. Early ECD centres require children. No child aged 24 months is to wear masks, and for B, a child aged 2 to 5 years must be encouraged to wear a cloth mask to prevent the transmission of disease. As subject to the measures set out in the standard operating SOP, which we've just read. Still, there's another document from the Department of Basic Education, so this is an entire different department, and they are here addressing containment and management of COVID-19 in independent schools and ECD, Early Childhood Development Centres. Now, they have they have stated that wearing of masks and staying at home when sick is a good idea, which of course it is, to ensure that learners are trained in the proper use of the cloth mask. And here, when managing COVID-19 in the cafeteria, the catering staff must wear headgear and masks to cover their nose and mouth, which seems good. They must also wear closed shoes to protect their feet. I'm not sure what COVID-19 is doing to their feet, but policy is policy. Now, these are the official South African documents. All of them are issued as a response to the information and the uncertainty that we had originally 5, 6, 7 months ago. There is new information, and every week that goes by, there will be more studies and more data for scientists and doctors to give us a more well-rounded picture. What is the latest information? Well, officially here in this country, as far as I can tell, nothing. The NICD, my local pediatrician, refused to give me any official information. And I've been referred to the same old documents that were put up on websites 5-6 months ago. So we're being encouraged to follow the policies which are outdated. Going forwards, making plans for next year for industry, business, and schools, we would like to have an idea of where we're headed. And the purpose of this video and the videos you're about to see is to encourage you to not be fearful. That the fear that was warranted in the beginning because of the uncertainty is dissolving, and now we have more certainty and less reason to fear. In the school context, it is incredibly safe. It is incredibly unlikely for them to, one, contract the disease of COVID-19, and two, transmit the disease. And if you are an older person, 60, 70 plus, it is incredibly risky for you to contract the disease, and I assume transmit it as well. When it comes to old age homes and frail care facilities, without a doubt, ensure strict protocol and measures are in place. When it comes to schools, other concerns, psychological health and social health, which are also very important to developing children. Now, I am not any authority, I have absolutely no training in this, but according to those on the front line, this disease should be taken seriously if you have it, or if you are close to it. But if you don't have it, you don't need to live as if you do have it.
Sweden's state epidemiologist and head of the Department of Monitoring and Surveillance at the Swedish Public Health Agency. And I also have to ask you about face masks, because that is something that across much of Europe and in the US, citizens are encouraged to wear face masks. This has not been a policy that you've encouraged in Sweden. Why is that?
I think the face mask issue is not completely easy. Face masks in healthcare, in social care, and so on, of course, has a long tradition. Everybody knows how to do it. They are very, very important, both to keep staff healthy, but also to avoid the spread from staff to the patients. So that's, of course, used in Sweden all over the place, no question about that. Face mask out in society is a different kind of thing. There's a long tradition about that in Asia, but in Sweden and Europe, it's never been like that. When you look at the evidence behind using face masks in society, they're not that great. Very few studies have been done. I saw one from CDC lately that showed that this face mask might not make that much of a difference. The other studies and also modeling and so on showing that, yes, they might make a big difference, but we don't really know. It's definitely our feeling or our belief that keeping distance is much more important. And fortunately, we are in a place in Sweden where we can keep distance. We are not a very crowded country. Most of our cities, with a slight exception of Stockholm, are not very crowded. We are also a rich country, which means that we don't have to fill our buses to 120%. So we can keep distance. And as long as that works, our strategy is not to use face masks. If that doesn't work anymore, of course, we'll look at face masks and maybe use them for a short period in some places. You also have to realize that the experiences in Europe are not that great. Many of the countries that are now looking at huge increase of cases have had legal obligations to wear face masks for quite some time, and which does not say it could have been even worse without a face mask. Of course, we don't know that, but it's also quite clear that face mask is not going to be the silver bullet. It's not going to make that huge difference. And then I think it's a bit dangerous to believe that you can change so much by using face mask. But of course, there are places and times when they might make a difference, and then we will of course use them. So far, we've been able to cope quite well without them, and then I think it works better in Sweden without. I get mails from many Swedes coming back from other countries and saying, "Oh, happy they are back to be back and being without the face masks." Face mask is problematic, I would say. I've worked in infectious diseases for a long time. It's something you use, but it's not something that you would like to use if you didn't have to.
Yeah, interesting. I now want to turn to the topic of immunity.
The normal yearly flu, where many people have immunity around it, really slows down the spread and diminishes the spread quite a lot. A normal flu season might result in some 4 or 5% of the population getting ill or something. When we have a flu that we are not immune to, we reach level 40, 50% maybe. So of course, immunity does have a role with any kind of infectious disease, almost. There's a few exceptions, but not many. The immunity of COVID-19, how that works, we don't really know very well yet. But we do know that people do get immune because 6 months or more into the pandemic, we see very, very few cases of people who have been infected twice. So logic tells us, yes, people do get immune. And in some way immunity will slow down the spread of the disease. The real thing is, of course, how many people do get sick a second time. I mean, that shows the real immunity, not just the level of antibodies. And I think that's the most important thing to follow, and that's followed very, very carefully all over the world. And I think last count I saw a week ago or something like that so far we have found 20 people in the world who has had the disease twice. And of course, considering that hundreds of millions of people have had the disease, the risk so far is not very great. On the other hand,
so another topic that a lot of our listeners are interested in is schools. And they're very interested in the Swedish experience with keeping schools open. How do you manage it? Is it the health authority that is making those decisions together with a school board? Are you seeing teachers and staff getting sick? Just what's the experience been over these past 6 months?
We had a lot of discussion with the school authorities on the national level in the beginning of this, and based on the data from China showing that children very, very rarely got severely ill, and also that a lot of the early report from China also said that children very rarely are infecting other people, even if that's often difficult to measure in any reasonable way. And that coupled to that, we know that having children in school are very important for their health, short term and long term. And we can also now see from other countries who are close to schools that children are really suffering. I mean, that's a big concern, I think, that children are really suffering all over the world from not being able to go to school. Abuse at home increases, malnutrition increases, so many things happen when children are not able to go to school. So you really need to think carefully about closing schools, especially if you do it for any longer time periods. And that's why we decided to keep them open and follow it carefully. And I would say that during the spring we saw almost no outbreaks in schools. We saw a few outbreaks, but then among teachers, obviously teachers infecting each other because there were no children involved. And it was very clear that it was a teacher coming back and infecting colleagues in most cases. We have afterwards looked at the rate of teachers being hospitalized with COVID-19, and it does not differ from other professions. It looks like it's lower than quite a lot of professions. There are other professions that have a higher risk of ending up in hospitals. Of course, this is a complicated matter also connected to socioeconomic issues and so on, but we do not see that teachers are more affected than anybody else. If anything, they are affected less than anybody, most other people. What we see now after the spring, because in the spring the high schools were closed, as you said, we do see that high school students are different. I mean, in those 15 plus children, there is some spread. They don't get severely ill. Teachers don't seem to be very much affected, even if they are affected a little bit more than teachers of younger children. But there we do see some spread. So of course it's not an on and off button, but the younger the children are, the less sick they get and the less they spread the disease. And I would say that our general experience with keeping the schools open are very, very positive.
What is your take on this argument that if we want to resume normal lives, we will have to wait for this vaccine and for all to be vaccinated?
But I think the main issue is that, yes, deliveries will start somewhere reasonably early next year, but they will be spread over a year or two, which means that we will not have a vaccine that will affect the spread in the population for at least, earliest next fall, if we are lucky. Because we do really need to vaccinate probably around 40-50% of the population to see any kind of reasonable effect on the spread of the disease.
Over the past few months, experts have repeatedly warned the easing of lockdown could lead to a second wave of coronavirus. Death rate, though, officially is falling. It continues to fall. And flu and pneumonia now kill 6 times more people than COVID. So there are professionals who are saying maybe we don't need to be as concerned as we have been.
Yeah, we're joined by Professor of Evidence-Based Medicine, Carl Hennigan, with his thoughts now. Good morning, Professor Hennigan. Do you think we shouldn't be as worried as some people say we should?
Well, look, you've just outlined, say yesterday in hospitals in England, there was 1 death recorded. So you can see the impact of the disease in terms of its impact on admissions, critical care units is at an all-time low. What we need to be is still vigilant about the virus. We still need to think about our social distancing and our hand washing. But particularly as we go back to schools now, we should be reassured that the risks for children are incredibly low. And actually, your message is right. In fact, they're more at risk from infections like influenza.
You say there are a lot of people who are worried and anxious because we're told to be. And then we get worried and anxious when we see people who are not worried and anxious, honestly, genuinely confused.
Yeah, and I think that's part of the problem. I looked at some of the messaging coming to an area like Oldham. Even I couldn't understand.
Well, good evening. Look, thank you, as always, for being with us. We don't take your support for granted, I have to tell you. I've talked from day one about this mess over coronavirus about alarmism and hysteria. The ultimate symbol of alarmism is the word pandemic. I watched the Dally M Rugby League Awards last night, more of that later. But because of the hysteria, we're constantly told about the year of the pandemic, as if we're in the midst of the Grim Reaper. A pandemic is a disease which is prevalent over a whole country. This is not a pandemic. It was never a pandemic. So let's look briefly at the facts surrounding mortality. We'll continue to hear stories about more cases, a second wave, more masks, more lockdowns, more fear. As at today, if we take countries from America with 328 million people to Sweden with 10 million, and outfits like Italy, France, the UK, Spain, and Australia in between. Now remember, these statistics are of people who died with it, not from it. They had other preconditions. But let's start with America, 328 million. The percentage of population who've died is 0.07%. Alarmism says Trump must suffer because he hasn't imposed draconian lockdowns. Italy, population 60 million, deaths 0.06%. France, alarmism everywhere. Population 67 million. Deaths 0.05%. Sweden, no draconian lockdowns. Basic precautions, but get on with your life. Population 10 million. Deaths much the same. 0.06%. The UK, population 67 million. The Prime Minister was forced into lockdowns by alarmist modelling. Deaths 0.07%. Spain, 47 million. Deaths 0.07%. Lockdowns everywhere. The deaths marginally the same as Sweden with no lockdown. Australia, population 25 million, but we're an island continent. Had we not had Ruby Princess and international travellers, we should have escaped easily. Even so, the deaths are 0.0035%. But look at the price we're now paying. Is this a pandemic or just another flu? I have for months cited one international authority after another who's argued that the strategy is wrong. Professor Joel Kepner from Manitoba University in Canada has said, and I quote, "I've seen pandemics, one every year. It's called influenza and other respiratory illness viruses. I've never seen this reaction, and I'm trying to understand why." And of course, Professor John Ioannidis, the Professor of Epidemiology and Population Health at Stanford University. Now think of the figures I've just given you. Professor Ioannidis has said, if we'd not known about a new virus out there and had not checked individuals with PCR tests, the number of total deaths due to, quote, influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems to be a bit worse than average. The media coverage would have been less than for an NBA game between the two most indifferent teams, unquote. So there you are. We're in this economic sewer because we failed to listen to world authorities. What do you think? Alan at skynews.com.au or the text line 0414 000 848.
Last year's flu season, the CDC estimates that the influenza in the USA affected between 39 and 56 million people, with 18 to 26 million medical visits and somewhere between 410,000 and 740,000 hospitalizations. These hospitalizations led to 24,000 to 62,000 deaths from the flu. This slide shows a direct comparison between influenza and COVID-19. Case fatality rates, which are the percentage of people who die from the virus divided by the total number of cases that present for medical attention, were 2 to 4% for the 1918 influenza pandemic, compared to the current case fatality rate, which is 2.8% in the US as of today for COVID-19, today being October 11th. Now, the infection fatality rate, this is a little bit different, and this is the number of people who die divided by the total number of infections. So we're not just talking about cases that come to medical attention, but actually everybody that gets the virus. This is obviously a much lower number than the case fatality rate, and typically this is what everybody's most interested in, meaning that if I get the virus, how likely is it that I'm going to die? It is typically reported on the order of 0.1 to 0.2% for influenza. The IFR rates for COVID-19 depend upon your age group. These are the recently CDC reported numbers from September 2020, which are based on data acquired up to early August. If you're under 19, the chance of dying if you pick up the virus is 3 in 100,000. And if you're in the 20 to 40 age group, it's 1 in 10,000. It becomes on the order of 1 in 500 if you're in your 50s, and about 1 in 100 in your 60s. It's 5.4% if your age is over 70. The overall IFR in the US and in other countries is on the order of 0.3 to 0.7%. There are a number of factors that will affect the IFR.
Kulldorff from Harvard, Dr. Sunetra Gupta from the University of Oxford, and Dr. Jay Bhattacharya from Stanford. I am delighted that the three of them join me now from Great Barrington, Massachusetts, where they've been meeting all weekend. So perhaps if we just start with you, Dr. Kulldorff, what are you doing and why are you there?
Well, thank you for having us. One of the basic principles of public health is that you cannot look only at one disease. You have to look at public health very broadly. And the strategy we have used for COVID-19 has not been good for COVID-19, but it's also generated enormous collateral damage on other public health. Less plummeting vaccination rates, less cancer screening, worse outcomes from cardiovascular diseases and mental health problems, and so on.
We learned a lot about this disease in the 8 months that we've had to live with it. In particular, we've learned what groups are most vulnerable should they become infected for mortality and other severe bad outcomes. We also learned about groups that are relatively well protected, even should they become infected. Children, for instance, in the United States, more children have died this year from the seasonal flu than have died from COVID-19. Children, and thank God, are relatively protected from COVID-19 infection should they become infected than an older adult, 65 or 70 or higher, who really are in a vulnerable position.